There is no one I trust more than this guy when it comes to any facial procedure, especially rhinoplasty. Dr. Doug Handstrom with Utah Facial Plastics joining me now to share how a skilled touch can turn a disappointing nose job into a confident comeback. And Doctor, we always talk about what you have done for me, which was the max lift, the mid facelift, and I sing your praises all the time.
I appreciate that.
But I do want to share a personal story. Back in 2008, before I knew you, before I knew Utah Facial Plastics, I got a rhinoplasty.
Okay.
And after a few months, a little part of my nose started to sink in, a little bump appeared. I went and got a revision. It helped, but it's still there. And I wish that I would have known you, because I would have trusted you and your team completely. I have to imagine that this is something common, people wanting to change their nose or unhappy with how a nose turned out.
Yeah, well, primary rhinoplasties, the times that we do a rhinoplasty for the first time, very common. I mean, I've already done 6 rhinoplasties this week alone. A lot of patients want to change their nose, whether it's a functional issue or cosmetic issues. Revision rhinoplasties happen when we survey patients that have had a rhinoplasty. About 10% of patients nationwide who get a rhinoplasty will have something revised on their nose at some point in time. Often a little thing like yours, a little bump or a sinking in that we've got to deal with. So it's not an uncommon thing in the world of rhinoplasty surgery.
Yeah, I think it's also important to note that this surgery, a surgery on the nose at all, is complicated.
Very complicated. In fact, it's one of the reasons why I love rhinoplasty, because the nose is one of the more complex three-dimensional structures on our face or even on our body. There's multiple layers that we have to test for. Inside, the structure of the nose, the outside skin. And so it is a very complicated procedure, and when we're revising something, it just gets more complicated.
Look at that beautiful work, though.
Yeah.
It's a subtle difference, but it is everything with changing that look and appearance.
Yeah, so this nose was just left undone, really. The nasal tip really sunk down. She couldn't breathe very well. There's a couple complications from the previous rhinoplasty that had been done. So we wanted to lift it. We wanted to shape it better. We wanted to give her confidence about her nose, but also help some of that function. So both of those things can be addressed and should be addressed in the primary rhinoplasty, but certainly when we're talking about a revision rhinoplasty, we've got to take all those things into account.
Yeah, and because it is complex, you want to be in the best hands and know if it's right for you. So how do you know if you're a candidate?
Well, you need to meet with a surgeon that does a lot of revision rhinoplasty, like we do at Utah Facial Plastics. So you want to have confidence that they know what they're doing and that they've had experience handling the nose in a way that needs to be handled for a revision, because it's different, and you're going to encounter different things when you go in there for a second or a third time. What kind of scar tissue might be in there? How did the nose heal? What was done before and what can be changed? So you really want to have a good consultation with somebody that knows what they're doing, that has experience with it, and you feel confident can handle your specific nasal issues.
Yeah, and you would advise come in, have that consultation, you can talk through, because each situation will be so unique, but you also have the technology to show them what it might look like.
Yeah, we can take some of your images and morph them so that we can give patients an idea of what their nose can look like if we execute this rhinoplasty as we plan and they heal like we expect them to. And sometimes that's one of the frustrating things about rhinoplasty, is how does a patient heal after surgery? Do they heal in the way that we want them to, or is it going sideways and we need to do something along the way to help their healing better, like taping the nose or maybe even injecting their nose with a little bit of steroid to help them?
Oh, those before and afters are just stunning. They speak for themselves. All right, go make that consultation. And a new location. Utah Facial Plastics is opening a Heber spot. When does that happen?
Well, that happens December 1st. We're so excited. So if you want a consultation or if you want to come in and see our injectors or our estheticians, we are now opening one up in Heber on December 1st. So we're now in Layton, Draper, and Heber. We're going to have consultations up there as doctors, but you can see our whole team up there starting on December 1st. So we're very excited about that. Come and see us.
Oh, I'm so excited for that. Congratulations.
Thank you.
Expansion.
Yeah.
I'll see you soon.
Yes.